it does feel like a breast. When the implants are in, they feel very much like a breast. It's hard to tell that they're there. And I think that's the best outcome when you can't really feel the implant. You know it's there, but you can't really feel it. I think one of the reasons why people feel their implants is when they're under the muscle. I think the stretch of the muscle over the implant is one of those feelings that a lot of people have a hard time getting used to, especially with larger implants. The muscle is stretched to a pretty significant degree, and your muscles can feel that. It's like when you're in one position for a long time and you just feel like you need to stretch your back because you've been sitting at a desk for a long time. I think there's some feeling in the muscle that when the implant is there, you can't get past it. And again, some people accept that very well and others don't. They always have a sense of tightness or a bra that they can't take off. One of the beautiful things about going above the muscle is that sensation doesn't happen. The muscle is in its natural state. When you exercise that muscle, when you use that muscle, it's not changing the shape of the implant, and patients don't have a sense of tightness in their chest or tension in the pec that they might have when the implant's under the muscle. If we circle back to Motiva implants, their favored position is in a subfascial position or above muscle placement because the implants tolerate that well. There's very little reaction around the implant, so capsular contracture rates are low, which was one of the reasons people felt like they had to put implants under the muscle, was to reduce capsular contracture. And then they have a very natural feel without having tension in the muscle. And also the breast looks quite natural. When you augment the breast with an implant directly behind the breast, you're actually truly augmenting the breast itself, not augmenting the breast and the muscle at the same time, which is always going to have some unnatural shape and feel to it because you're pushing the muscle forward and the muscle is not part of the breast. The muscle is a separate structure. I try to approach each patient separately and look at their anatomy. If they truly are very lean, very low body fat content, very little breast tissue, they will be at more risk for visibility of their implant unless we put it under the muscle. So I think there is definitely a place for submuscular breast augmentation, but it's an independent decision for every patient. We have to discuss the risks of the animation of the breast when it's under the muscle and the potential for discomfort with activity versus the potential of visibility of the implant. And you'd be surprised that the vast majority of patients have enough breast tissue to hide their implant pretty well. But those that don't, we still use under the muscle positioning, and usually that works really well and they're very happy. There's definite pros and cons, but there's a solution for everybody, I think. When I'm doing a consult with a patient and they're interested in Motiva implants, one of the fun things to do is hand them one. There's a definite difference in the way a Motiva implant looks because it's got the blue color to it. That's got a slightly opaque surface. Most implants will be a smooth implant that they're feeling. And when they put that in their hand, it feels sort of like cellophane to the touch. It's a little bit tacky, a little cool feeling in the hand. And then the Motiva implant is got a velvety texture on the surface, and then it feels very soft in the hand. There's a definite palpable difference in the hand. And patients tend to like the way that the Motiva implant feels in the hand because it's different than anything else they've felt. And it's very soft and it's velvety and it's comfortable feeling in the hand, perhaps. And it sets it apart from the other implants. So patients are immediately drawn to the way the Motiva implant looks and the way it feels.